Hello everyone! Today we're going to be talking about diabetes, specifically type 2 diabetes, which makes up for 95% of all diabetes patients. In the United States, 10.5% of all people have diabetes, and to put that in perspective for you, in 2018, that was 34 million people who had diabetes. That's a lot of people. So to educate us today and inform us about diabetes is my father, Dr. Phil Pappas, who has a PhD in nutrition, a master's in psychology, and a background in pharmacology. Thanks for joining us today, Dad.
Thank you, Lauren, for the nice introduction.
Absolutely. So let's get started. What is type 2 diabetes?
Okay, so there's type 1 diabetes and there's type 2. Our main focus today is type 2. And type 2 diabetes generally happens as we age. And as we age, our cells don't use insulin like they used to in the good old days. And what happens is we start to develop too much glucose. That's what the sugar form is in the blood. We eat our sugar products, it converts to glucose. We burn that glucose for energy, and we should be done. Trouble is, we're not burning it because our cells aren't using insulin properly to do it. And before you know it, our sugar levels come up in our blood, and we are now a type 2 diabetic or pre.
What is the prevalence of type 2 diabetes in America?
Okay, so that's 10.5% of the population roughly has type 2 diabetes, and that's roughly 34 million people. Type 1 diabetes only accounts for maybe 1.5 million people. On top of the numbers that we have for type 2 diabetes, we also have another 7-8 million undiagnosed diabetics at any one time in the population. Now, in seniors, type 2 diabetes becomes a real concern because seniors, just because of age, wear and tear on their insulin and their cells, have more diabetes. In fact, 27% of the adult population over age 65 has type 2 diabetes. So they do account for a large portion of the type 2 diabetics in the United States. There's about 1.5 million new cases of diabetes every year. And there's about 88 million pre-diabetics. These are people that aren't diabetic yet, but their numbers are starting to look that way. And they're concerned because they could become diabetic at any moment. And if they're not diagnosed, they're living with this high sugar in their blood, and they're not doing the right thing to protect themselves. We'll get into that a little more.
That's alarming.
It is. And diabetes is the 7th leading cause of death in the United States. It's about 83,000 people each year.
There are two extremely serious issues that result from diabetes. What are they?
One is eye damage. The little vessels of the eye, the tiny vessels of the eye, which are very fragile, are very susceptible to damage from elevated blood sugar. So as a result, there's almost 8,000 cases of diabetic retinopathy in the United States. Diabetes is the leading cause of newly diagnosed adult blindness in the United States. The other issue that's really important is amputations. Every 30 seconds, there's some type of foot, leg amputation in the United States. Diabetes accounts for 85% of all diabetes amputations. And that usually results from the breakdown of the skin, and we'll talk more about that, infection, and we'll get to that as we proceed.
Okay, let's talk about the difference between type 1 and type 2 diabetes. I think a lot of people get those confused or they don't really know the difference.
Yes, okay. So type 1, which is a small amount of people, 5% of the population roughly, have type 1 diabetes. Usually have it from birth or very young age. And it really is the issue is you don't produce insulin, or you produce so little insulin that you need insulin to use up that blood glucose, the sugar in your blood. So without it, you would be sick right away and die. Mm-hmm. So that's type 1 diabetes. Type 2 diabetes is a little different. In type 2 diabetes, you're not responding to the insulin you have. Your cells aren't using it properly. And over time, if the body keeps getting that abuse, if things aren't corrected for the type 2 diabetic, medication, exercise, or whatever, that person will end up on insulin also. That's the more of an end point. Just to give you an idea, my grandparents would have called it old age diabetes, not type 2 diabetes. But now, type 2 diabetes is common even in 40-year-olds.
Mm-hmm.
So because of the change in diet and the way we eat, it's becoming, much more prevalent even in younger adults.
Yes, that is very interesting that your grandparents would say that the older generation would refer to it as that.
Yes.
As it should be referred to, and it is scary that a lot younger people, even in their 20s, have diabetes, type 2 diabetes now.
Yep. My grandparents would have never imagined people in their 40s with type 2 diabetes. Just would have never come into their minds.
Yeah. Processed foods. How does sugar affect a diabetes patient?
Okay, so sugar, your body converts it to glucose so that you can use it for energy. If you don't use up that glucose, it circulates through the blood and it causes damage. And it's akin to putting acid in your blood because it attacks the lining of the artery, attacks the heart, the kidneys, the eye, the liver. Every organ is being attacked. And you don't know what's going to break down. So it's really a bad situation. Generally speaking, it's the vascular system that gets hurt first. That's why the blindness, you get neuropathy in the feet, poor circulation. Before you know it, your blood pressure may start to elevate, and all kinds of things kind of go wrong from there. When glucose is in your blood, it actually thickens up your blood, changes the viscosity of the blood, so the blood doesn't flow quite as well. It doesn't get to where it needs to be quick enough, And it can be clumpy, and it can be much more prone to clotting. That would lead you to the idea that it could cause strokes and heart attacks, which is what it's a real dangerous thing.
Mm-hmm.
At least 50% of all type 2 diabetics also have some form of heart disease.
It's scary that sugar can cause that much damage and that it's so prevalent in our food nowadays, and all this processed food is so easy, it's at our fingertips, and people are treating that like food when it's really not food. And the whole issue behind this is what people are eating is causing this disease.
Sugar was not truly part of our diet, raw sugar. Nobody, that's like a fun thing that introduced into our diet not that long ago.
Mm-hmm.
A white potato converts to sugar and glucose, but it does it slowly. But sprinkling brown sugar all over your pancake or a sweet potato and whatever, that's really kind of harmful, and we're not built for that.
Mm-hmm.
So, you can do it once in a while, but when you do it all the time, that's a problem.
Mm-hmm.
Eating French toast, for breakfast every morning with syrup and all that. I mean, that is just something that, man was not built to do.
Yes, right. Can type 2 diabetes be cured or reversed?
Okay, so it can't be cured in a sense of we'll give you something and you're cured. That just isn't going to happen. However, what we've been talking about, sugar being the player here, the thing that causes the problem in our diets, the logical way to manage diabetes and bring your blood sugar levels back down is to eliminate sugar from your diet. It's a pretty simple give and take situation. You want to lower your blood sugar levels? Take the sugar out of your diet. What does that mean? It could be sugar that, when you see somebody put 2 and 3 teaspoons of sugar in their coffee, they don't like coffee, they like sugar.
Right.
And when you do that with food, that type of thing, somebody eats pasta all the time. Pasta is not really, it wouldn't be something you would use in a diabetic diet because it converts to sugar very easily. Too much rice in the diet, too much pasta in the diet, too much bread, cakes, all those things. You push that away and you eat your fruits, vegetables, and you limit your fruits till your blood sugars are under control. vegetables, meats, dairy. Most dairy is actually pretty good for somebody trying to control their blood sugar. So if you do that, you're going to change the outcome. You're going to manage your type 2 diabetes more appropriately. Now, it's very important to check your blood sugars every day, and diabetics tend not to do that until they're much more seriously ill. You need to do that right away and make sure you're under control. So, yeah, manage your diabetes. You could use a low glycemic diet. That's what we call it. We have a glycemic index of different foods that are high glycemic, low glycemic. You eat low glycemic, you avoid the high glycemic.
Right.
And this is how you manage your type 2 diabetes, along with possibly medication, very likely medication. And if you're not there yet with the medication, there are lots of supplements that can do it also.
Right.
But you got to exercise and you've got to control the diet.
Right. And it's amazing when you do eat low glycemic how much that changes your body composition and
Yes.
you know, you're able to maintain your weight. For me, when I've been getting ready for a shoot or, you know, a bikini competition, I eat low glycemic. I tend to eat like that anyway, but I really follow that. Eat low carb, focus on nutrient dense foods and meats and vegetables and fish and things like that and eggs, and I feel amazing, and then I get the aesthetic that I want as well, which is really cool. But most importantly, it makes you feel amazing and it improves your overall health. Is stress a factor in diabetes? Could that cause diabetes?
Yes, and it's a little more complicated than maybe we have time to fully get into today, but I'll give you the quick notes. Stress has clearly been linked to things like diabetes in particular, but it's linked to a lot of things. And in fact, there's about 129 conditions caused by stress. And you say, how's that? I don't get it.
It's a lot.
Well, when your body's under stress, now I'm not talking about you just cross the street, a little bit of stress, you go home and you relax. I'm talking about chronic, ongoing stress. Your body changes and things change in not a happy way. But that's part of the stress syndrome, what's going on. So some of the simple things in the beginning is your heart rate will go up a tiny bit. Your blood pressure will go up a tiny bit. Then it gets a lot more complicated. Cholesterol starts to go up because that's a protective mechanism. These are protective mechanisms. Unfortunately, they also tend to create inflammation in the body. And this low level of inflammation over a long period of time starts to create problems. It depresses your immune system. It irritates the lining of the arteries. You don't want that because that's the beginning of heart disease. So all that is inflammation in the general sense. Your body doesn't need more inflammation, it needs less inflammation. So yes, all these things come together. Suddenly your blood sugar levels go up. That's part of a protective mechanism. And it's an adaptation mechanism. And before you know it, that sugar's up all the time and it's starting to cause damage. And you've got a real problem on your hands. Suddenly now you're visiting your doctor and he goes, every time you come, your blood sugar is elevated. You're now a type 2 diabetic. We're going to have to put you on medication. And the medication he may start you with, well, we'll talk about medication, but he'll start you with something subtle, maybe oral. And if you don't respond, he's going to add things. And at the end point, you're going to end up on insulin.
That's interesting how that all one thing leads to the other, and just astonishing how destructive stress can be on every part of your life and every part of your physical and mental health. It's really something that I think our country needs to work on, controlling, managing, preventing stress, which we did a video about.
Well, not only don't people take in consideration what stress does to our body, how it hurts us, well, it's just stress. But it's not just stress. It's much worse than that. And doctors, most doctors are going to worry about stress, but now doctors are seeing over the last 50 years, what stress is doing to us. We're living in a society that's highly stressed, and doctors are becoming more and more aware of it. But when you're, let's say you go to an endocrinologist, that's somebody who would be an appropriate physician for diabetes. And is he going to say to you, you can't drink, you can't, eat carbohydrates? And most people are just going to ignore that advice.
No fun? I don't want no fun. I want to keep
Exactly.
having a good time.
Exactly. And I've been told that by endocrinologists.
Yeah.
What am I doing? They won't listen to me.
Yeah.
They don't want to change. So I give them medication.
Right. But if you do put in the work and you do make these life changes, you feel so much better, and it's so much more rewarding than how you feel when you eat carbs or drink alcohol. How does type 2 diabetes affect the immune system?
Okay, so this is where we were talking earlier about amputations. So when you have diabetes, you probably do have stress too, but your diabetes is actually compromising your immune system. And as we compromise the immune system, we elevate the chance or the risk of having infection. And particularly with a diabetic could get infections of all types, and they're at more risk when they get pneumonia, when they get a urinary tract infection, when they get a kidney infection. But they're at super risk when they get skin infections, and diabetics are prone to skin infection because they don't get enough blood flow to the skin. They develop neuropathy in the nerves. A lot of stuff starts breaking down. These little tiny nerves, little tiny arteries start breaking down, closing down. Blood flow is restricted. Boom. They get a little nick or blister, in their shoe. That blister can get infected, and they can end up with an amputation in the worst scenario.
Mm-hmm.
And if you ask a doctor who deals with diabetic wounds of the feet, maybe it's a podiatrist, he's going to tell you it takes a long time to heal, whereas you and I will heal very quickly.
Mm-hmm.
In that longer time to heal, the risk of infection goes up significantly, and then the ability for a diabetic to clear that infection with that reduced blood flow, it's just not so easy. And if you put antibiotics into that person, it doesn't get to that wound because the blood flow is reduced.
Wow.
So it all works against them, and before you know it, you have a partial amputation or some kind of problem like that, or maybe a whole leg.
That's terrible.
Mm-hmm.
Is a type 2 diabetic patient immunocompromised?
Well, yes, it goes along with the question just before. If you're having, all these issues, your overall immune system is not that good. So yeah, you would call that person immunocompromised. They're more susceptible to an infection. If they are in a terrible accident and end up in the ICU, intensive care, they're going to be much more susceptible to infection and all types of things that a healthier patient won't be.
Mm-hmm.
So yeah, it's a big risk factor. They are immunocompromised.
Mm-hmm. Let's talk about the life expectancy for a type 2 diabetes patient.
All right, if I could just back up to the type 1 diabetic for a little bit. When you read about the statistics, that type of thing, they're going to tell you that a type 1 diabetic is going to lose about 20 years of their life. 20 years less of life for type 1 diabetic. About 10 years loss or less life for a type 2 diabetic. And that's because of the risk factors. They may develop pneumonia, they may develop some type of blood infection. Something's going to lower their overall life expectancy.
Right, but if you manage it through eating healthy and exercising, you can lower that. Or
Absolutely.
You can lower the life expectancy.
Yes.
So you would have a longer life if
Exactly.
if you exercised and you ate healthier,
Mm-hmm.
which is great because it gives people who have developed type 2 diabetes hope that they can control it.
Yes.
Speaking of exercise,
Mm-hmm.
let's talk about how exercise can help with diabetes.
Okay, so exercise is really important. When you say, well, he does a lot of walking or she does a lot of walking. Well, that's actually one of the most ideal exercises because you're taking those big muscles in the lower extremities and you're pumping them. You're pumping the muscle. You're pumping the blood. So you're burning your glucose more efficiently. You're pumping blood through those arteries more effectively, and you're keeping yourself healthier. But of course, you have to control the diet.
Mm-hmm.
So yeah, exercise is extremely important. And there's a second role for exercise, and that is keeps the heart itself healthy, which is really important.
Mm-hmm. I love walking. I'm such a huge fan, as are you.
Mm-hmm.
And even if you don't have to have an hour to dedicate to it. You could do like 10-minute walks throughout your day after each meal. Take a 10-minute walk, and then it becomes more manageable for people to fit it into their schedules. Let's talk about pharmaceutical products. What pharmaceutical products are for diabetes patients?
Okay, this is probably more than we can handle in our little video. But most physicians, if they go to medication, the first thing they're going to give their patient, if they discover they're type 2 diabetic, is metformin. Metformin's been that introductory level product. It's a keystone kind of product. Even if it doesn't work completely and they add a second product, they're going to keep that metformin on board because it does a great job. Now, there's a whole bunch of products in between. And as you go up the chain of oral products, you can almost guess that the side effects get worse and worse. Metformin, low side effects. As we go up the chain of oral diabetic products, the side effects are going to get worse. So you hope you can manage it with metformin or with diet and exercise or supplements or how we're going to do it. But if you've got to take a drug, metformin's a fairly safe one. The end point, if you're not successful in controlling your blood sugars, is insulin. And once you're on insulin, it's kind of an endpoint kind of product. You've already caused damage. There's already problems. Insulin in and of itself has problems. Some of those problems would be people seem to increase weight on insulin. Insulin seems to be linked to even more heart disease. So, you have to be very careful. You've gotten to the end point. What are you going to do? And insulin is that end point.
Explain why a doctor does a blood sugar test and hemoglobin A1C.
Okay, so these are two tests that your doctor might give you. And there might be others. In fact, there are others. But these are the two big ones. Now, the difference is a blood sugar is a moment in time. And hemoglobin A1C is a 3-month look at your blood sugar.
Oh, interesting.
So
didn't know the difference.
They both have a role. So if you go to the doctor and he has you in once a month, say for 3 or 4 months, and he does your blood sugar, and your blood sugar is elevated each time, he's real concerned. And if you're 185, 210, whatever it might be, you should be below, I don't know what number they're saying now, but my guess is 105, or now I think maybe they've lowered it to 100. But he's only catching you on the day you came in.
Right.
The way to really do blood sugar is at home. Every day you stick and you test it. And that way you get a little more accurate. Are you really controlling your blood sugar? Or is this just a phenomenon when you go into his office? Probably not, because if you're as high as I just said, you've got a problem. Hemoglobin A1C is a big picture. So you need both of those tests, really. Now, today I noticed, as I talk with physicians, they're using hemoglobin A1C even more than they used to. I mean, it's become a real good measure for them. How's my patient doing? All right, we want to see that number come down. And I believe it depends on the lab, I guess, but you certainly, when you're in the 6s, you're pre-diabetic, and you want to get that down as low as you can, back, 5.9, 5.8. So your doctor's looking at that number. Is it going up? Is it stabilized? Is it going down? So very important markers for a diabetic. But a diabetic should be taking their blood sugar every day.
Okay.
And maybe 3 or 4 times a day. I forget what they're recommending, but certainly 3 times a day would be something you might want to do until you really you're really managing your condition.
Let's transition into supplements for treatment of diabetes? If you wanted to take a natural route, what would you take?
Okay, so supplements probably are not for a person. I'm not saying they couldn't, but when you're already on insulin, you've really gone a long way down the road. When we think of supplements, we're thinking of either a person with pre-diabetes or recently diagnosed diabetic, maybe that's on metformin. And there are a lot of supplements that do a wonderful job controlling blood sugar. And we're going to go through them, a few of them, most of the important ones. You always hear cinnamon.
Mm-hmm.
And this is not cinnamon you sprinkle on your French toast. This is therapeutic concentrated cinnamon that you would take in capsules. So don't think that using a little cinnamon on something is going to correct your blood sugar.
Right. I think some people do think that.
I think they do.
Yeah.
And cinnamon is certainly a great product for that. And if it works, great. And I do have a client who uses cinnamon as his only blood sugar control. Gentleman's in his 90s.
Wow.
And it does a great job, but he's the only one I have.
Mm-hmm.
You know, you usually have to use something else with it. But use correctly, and if you're diligent and you correct your diet, it's going to work. Now, there's berberine, and I bring up berberine right away because berberine is an herb that is literally just like metformin. It seems to have the same qualities. Now, it has less side effects overall than metformin. It controls blood sugar about the same. Berberine, however, is also good for your heart. And berberine is actually kind of an anti-infection type of product also. I don't know that I would choose berberine for a foot wound, but if you're taking berberine for your blood sugar, it might be really helpful.
Mm-hmm.
May prevent something. So berberine is a great product. Now, generally speaking, I like berberine with a couple other things.
Mm-hmm.
We'll get into that in a minute.
Yeah, I've heard a lot of people rave about berberine and how helpful it's
It's
been.
famous in Lyme disease.
Mm-hmm.
Berberine seems to do a good job killing bacteria. So important for a diabetic, but maybe not anti-infective in the sense that if you've got an infection, you've got to do something else. Now, there's some really key products that really should be in a formula for diabetes. Chromium. Chromium helps insulin get into the cells better.
Mm-hmm.
So it's very important. Now, for years, people have been using B1, thiamine. Today, though, over the last, 5, 6, 7, 8 years, we have a product called benphthiamine, which is a fat-soluble B1. So it's a little different. And it is 3 to 5 times better absorbed than regular B1, than thiamine.
Wow.
So benphthiamine has some really good attributes that B1 we knew had, but it wasn't that effective. For instance, it protects, it's excellent for neuropathy. If you've got that foot neuropathy going, or you don't have it going, you're trying to prevent it, you want to use benphthiamine. You want to prevent neuropathies. You also want it to protect your eyes. Well, benphthiamine kind of does that, because if it can fix neuropathy in the feet, it may help in the retina with little blood vessels. For kidney conditions, it'll help not beat up the kidneys as much. It's protective for the kidneys. And for the blood vessels, extremely important for the lining of the arteries and the heart, but very good for the blood vessels. So benphthiamine is a must product. So we have chromium, benphthiamine, and there's one other product that actually might be 2 other products. Alpha-lipoic. Every diabetic should be taking alpha-lipoic. It protects the heart, it protects the blood vessels, it protects from neuropathy, does a lot of the same things as benphthiamine in a different way.
Mm-hmm.
So it's very important these are horrible things that can happen to you.
Yeah.
So you've got to protect against this. Now, sometimes we don't control blood sugars even with some of these products. And sometimes we don't control it with the prescription products. In fact, 50% of all diabetics who are being treated with drugs, with pharmaceutical products, are not under control.
Do you think that's because they are not eating properly? They're still eating sugar, and
Well, it could be that, or it could be they don't take their
drugs.
drugs properly.
Mm-hmm.
But it seems that it's hard to control type 2 diabetes.
Yeah.
So 50% are uncontrolled.
Mm-hmm.
That's a scary number.
That is.
So when I'm dealing with supplements for a patient, I look to see that the blood sugar is under control. If it's not, you can add things. You can add things like bitter melon and Gymnea sylvestre. These are Asian type herbs, and one's a melon. And they can control blood sugar quite well. There's something else that is quite effective that people use all the time and don't know it, biotin.
Mm-hmm.
We think of it for hair, skin, and nails.
Right.
Low levels of biotin will make your blood sugar out of control. And I discovered this many, many years ago working with female bodybuilders. They tend to get, because of the type of diet they eat, tend to get a biotin deficiency very quickly.
Yeah.
And their hair starts to break off and all that kind of their skin looks bad, but they tend to have blood sugar issues.
Interesting.
So anywhere from 5,000 to 10,000 milligrams of biotin may help control blood sugar, can be added on.
Mm-hmm.
A lot of people forget magnesium. Magnesium kind of cures everything. It's an amazing product. It's good for your heart. It's good for your arteries. It's good for muscle spasms. Yeah, it's even good for diabetes. So one of the biggest deficiencies, I think probably in the top 4 or 3, is magnesium deficiency. So very, very important. Magnesium. I always look for magnesium deficiency and zinc deficiency.
Mm-hmm.
Zinc would be important in the sense that it protects your immune system. So very important for diabetic. But magnesium deficiency is extremely common, and even more common in diabetics. And we have a testing program that we do at our offices, and we see this all the time. So I'm pretty sure that this is going to be helpful. Magnesium is going to be good for you. Another thing you want to think about, probiotics. Probiotics build immunity in the gut, and that's where your immune system starts, in the gut. So to prevent infections, that type of thing, really should be on a probiotic. Now, what we did for this video is we put together a package, and I'm going to have to refer to my notes for this, of 4 products that will help a patient control diabetes. And we put it all in one. So there's on the website, there's this one first item on the diabetic page with the 4 products in there. Mm-hmm. You click on that and you'll see that it's there. You'll see the 4 products listed. The first product we have there is a berberine product. In that berberine product is grapeseed extract, extremely important for diabetes, and alpha-lipoic acid. So you've covered quite a bit of ground right away.
Right, great combination.
The second product is an extremely important product. It has a few other ingredients. They're add-ons, and it's helpful. Little vitamin C, vitamin E. These are all helpful. But it has something in it called Hintonia. Hintonia has been used in Europe for a long time. The product is called Su-Control D. And this is an amazing product for making your hemoglobin A1C better. Mm-hmm. So it goes well with berberine. So if you're trying to get things under control, you want to have at least these 2 products to control the blood sugars. The next thing you want is chromium. So we added a chromium, a 600 milligram glucose tolerance factor type chromium. And this chromium is 600. Most chromiums come in at 200. So you're going to take 1 600 a day, and that will do the job for you. The other thing that we added to this is benphthiamine. We have a mega benphthiamine in this package, and it's a 250 milligram benphthiamine. And it has about 10 milligrams of B1, the old-fashioned B1 thiamine, but it's 250 milligrams of the better B1, benphthiamine. And those 4 products should get you started. So if you're sitting there going, I have pre-diabetes, or my doctor just said I have diabetes, he wants to put me on medication. If you want to try this This package is a logical way to go. As you go down the road and you're checking your blood sugars 2-3 months out, if they're not where they should be, you can always add biotin or gymnea or bitter melon. There's a few things that you can do to try to control, maybe even cinnamon. But I think on an entry level, these 4 make sense. And they probably will do the job for you if you control your diet.
Mm-hmm.
And again, controlling the diet's a real key. You've got to get a glycemic index and follow it carefully. Now, what do? Read it every time I eat something? No, after a month of working with a glycemic index, you're going to know exactly what you can eat and what you can't eat.
Mm-hmm.
It becomes part of who you are in your system. Now, we know that, let's say I want a little bit of rice once in a while. Well, that's not a problem because the other 3 things on your plate, salad,
Right.
string beans, and a meat, are low glycemic. So if you have a little rice that, once a week, that's okay.
Right.
It's probably going to be all right, and your blood sugar is still going to be all right. But you can't have, the worst thing you can do is sit down to a big plate of rice or a big plate of pasta. This presents some problems.
Right. Foods can heal and foods can kill you.
Yes.
If you choose the wrong ones. You have to choose wisely. And when you have something like diabetes, you have to eat like your life depends on it. And even if you don't, we all have to eat like our lives depend on it, because if you eat a poor diet and you eat tons of sugar, you might very well be on the road and develop type 2 diabetes someday or other diseases. So it's so important that we take how we eat seriously, eat like our lives depend on it.
You don't ever want to develop type 2 diabetes because what's in store for you, the harm that it's going to cause you, is going to be terrible. You don't want that.
Mm-hmm.
You want to fix this, you want to nip it in the bud, and you want to get things under control. If you don't, things are not going to go well.
Thank you so much, Dad. This has been so informative and really interesting, and I know that it will help many people out there. Thank you, Dad.
Well, thank you.
Thank you guys for tuning in.